Hi, substrates in parenteral nutrition. We all know that the basic protein requirement for different individuals is different. Say for infant is zero point 0.9 to 1 gram, adults 0.7 to zero point 0.8 grams, and for general population, according to the RDA, it's about 0.75 grams. However, when we talk about substrates for parenteral nutrition, we have to do a very minute calculations for amino acids. So I'm Dr. Eileen Canday, and today we're going to talk about different substrates for parenteral nutrition. So essential amino acids, you can organize them into three sections, okay? Because this is the first substrate that we are going to talk about is the proteins. Now, when we talk about proteins and essential amino acid, we know that this should be supplied through the diet. So the body cannot synthesize them. The amino acids, say leucine, isoleucine, lysine, methionine, phenylalanine, threonine, tryptophan, valine, these are all the essential amino acids. And even if one amino acid is deficient, the protein synthesis is limited. So, what is the age-related requirements? When we say infants, about 43%, children about 36%, and for adults, it's anywhere between 19 to 20%. So, different ages and stages of life growth requires different amino acids. And important here, especially when we are talking about parenteral nutrition, is the conditionally essential amino acid. That is normally which synthesized for the body, but in a different situation like stress, trauma, burns, or ICU setup, they are conditionally important. That is histine, tyrosine, cysteine, glutamine, and taurine. Okay, so you can give all these essential amino acids through a parenteral nutrition, and you can also give leucine, isoleucine, and valine in certain diseases. Talking about glutamine, it becomes essential in metabolic stress, and when you require glutamine, you have to also add it to your parenteral nutrition. Now, amino acids in parenteral nutrition is standard versus a special amino acid solution. So, what happens in a standard amino acid solution where there are crystalline amino acid mixtures? These provide around 4 calories per gram, and they are available in concentrations from 3 to 20%. Okay, and the commonly used one is about 8.5 to 10%. They contain all the essential amino acids and also variable amount of non-essential amino acids. Okay, it was developed many years ago in around 1937. Now, what happens to the special amino acid formulations? These are disease specific. So, when there is a renal failure, liver failure, you require a special amino acid. So, if you say liver failure, the first thing that comes to your mind is the branch chain amino acid. That's leucine, isoleucine, and valine. Also, there are other where you have to reduce the aromatic amino acids in liver failure. So, they will have lesser amount of amino acids from phenylalanine, tyrosine, and tryptophan. Okay, so basically you require amino acids for these purposes. Then comes to your immune modulators in parenteral nutrition. Okay, so glutamine, which is an immune modulator. And why glutamine is important? Especially it's a non-essential amino acid that becomes conditionally essential in burns, trauma, sepsis, or surgery. And it will enhance the lymphocyte activation. It stimulates the macrophages. It serves as a fuel for your small bowel mucosa. It supports the gut barrier integration, and also it boosts the antioxidants. Okay, so what does ESPEN recommend? That as per the European Society of Clinical Nutrition and Metabolism, they say that severe burns, trauma, and ICU patients requiring PN, if there is acute pancreatitis or if there is a major surgery, then you need to give L-glutamine, which is the dose is around 0.2 to 0.4 per kg per day, which is almost equivalent to 0.3 to 0.6 grams of L-glutamine dipeptides. So, why given in a dipeptide? Because free glutamine is unstable at aqueous solution, and therefore it is supplied as L-glutamine or G-glutamine, and these are stable and they are rapidly hydrolyzed, and this glutamine hence is a fuel for the enterocytes. Dosage is again almost 0.2 grams per kg per day. Now coming on to the next substrate, which is the carbohydrate. Now carbohydrates, the role is about 50 to 60% of the total energy comes from carbohydrates, and in enteral nutrition we of course we use from different sources of maltodextrin, sucrose, etc. But in parenteral nutrition it is dextrose that is used today. And why only glucose in parenteral nutrition, that is dextrose, is it provides around 3.4 kilocalories, and remember this is not 4 calories per gram. It is very reliable, stable, inexpensive source of energy, yeah, and therefore it can produce also ATPs without without oxygen, so that is in the anaerobic glycolysis. It has a better ATP oxygen efficiency ratio, and it provides the substrates for the Krebs cycle. So thus it also supports the non-essential amino acids. Okay, so why not fructose or polyols? Because fructose are from fructose sugars as well as sorbitol and xylitol. So therefore here dextrose is the main source of carbohydrates in this PN solution. Also moving to the glucose requirements in adults, when we talk about the basal requirements, it's almost 2 grams per kg per day. So when you're doing the calculations, remember you require glucose to a level of 2 grams per kg per day, and it should it should not, the maximal oxidation rate should not exceed more than 4 to 5 mg per kg per day. So which is equivalent to around say 7 grams per kg per day, or almost 20 kilocalories. Then we go on to the next solution of the substrate, and we are talking here about the role of lipids in parenteral nutrition. So lipids it provides 20 to 40% of the total energy requirement. It supplies the essential fatty acids. It serves as a precursors, we know, hormone eicosanoids, and it supports the immune system. Although it is very important to understand that after infusion, that is, the triglycerides are hydrolyzed, lipids are exchanged, there are different fatty acids that you can be classified into. You can classify it as saturated, MUFA or PUFA, and we know that each one has a different double bond. The short chain could be less than 8 carbons, a medium chain is 8 to 14 carbons, and long chain triglycerides are 16 or greater than 16, and very long can be 20. In the omega-3 family, we know N6, N3 and N9, and essential fatty acid is linoleic acid, that is the N6, and the alpha-linolenic acid, that is the N3. Now, the daily requirements and the type of omega-3, omega-6 that is required is, a healthy adult will need anywhere from between 2 to 5 grams per day. Whilst when we look at even the infusion rate of lipid is important here. So when you talk about a complete PN admixture, you have to talk about different products that are used today. You should know the characteristics of the oil, whether it is a soya based oil, it is a high omega-6 content, because we know today omega-6 can be pro-inflammatory. Okay, and therefore we have to use the right substrates, because that is we have to use. So what is recommended, that you use about omega-3 rich oil. It could be a fish oil which has active components of eicosa, pentanoic acid and docosa hexanoic acid, that is your EPA and DHA. Okay, these are very important because it improves the outcome of the patient in various conditions. So if you talk of like an omega-1, which has a fish oil component, SMOF lipid, which is a mixture of MCT, soya bean, olive and fish oil. So if you actually look at the full form of SMOF is soya bean, MCT, olive oil and fish oil. Okay, they have a higher DHA and EPA content. Okay, so these are some of the ones that are used in the ICU. Also talking about the essential fatty acids, we as we cannot produce it in our body, they cannot be synthesized in our body, they have to be supplied through the PN solution, especially even omega 3, omega 6, and the requirement has to be as per the ratio. So if you say you require about 9 to 12 grams of omega 3, to every 9 to 12 grams of omega 3 you need to give 1 to 3 grams of omega 6 to it, and the total lipid dose should not exceed zero point 0.7 to 1.5 grams per kg per day over 24 hours. So what is the safety threshold? That the lipid emulsions are contraindicated when you have a very high triglycerides, that is greater than 4 to 5 millimoles, or if you say in mg per deciliter, it is 350 to 450 mg per deciliter. Now, if the triglycerides are moderately elevated, the lipid dose should be reduced also, and therefore, when you are looking at the lipids, if you see the donut chart here, it represents that the larger proportion of linoleic acid, and there's a small proportion of alpha linolenic acid. Okay, and therefore the remainder as other lipids is high quality, basically higher quantitative need of omega 6, but there is a small requirement for omega 3. Okay, so also coming to the next one is the structure of the different micronutrients that you require in PN. Now when we talk about PN, we say that we'll give carbohydrate, protein, fats from dextrose, amino acid, as well as essential fatty acid. What happens to the micronutrients? And therefore, when we talk about micronutrients, we talk about vitamins and trace elements. Okay, they have to be a part of the PN solution, because we understand that deficiencies may be clinically silent for a very long time, and therefore when ESPN has recommended, they say standard dose of micronutrient supplementation has to be given in all patients who are receiving artificial nutrition. So vitamins have to be present. Single vitamin products like multivitamin combinations are also mostly used in the ICU. And what do they contain? They contain A, D, E, K. Again, we understand these are fat soluble vitamins. Also, they do contain a complex of B complex, that is B1, B2, B6, niacin, folate, biotin, pantothenic acid. They also contain vitamin C because of the ascorbic acid requirements. So there are different beta lipid or solubit or crenvit. These are internationally used products. We can use locally available multivitamin solutions as well. Now, after speaking of multivitamin solutions, there is something that we need to understand, because we have now understood that trace elements are also an important part of outcomes and recovery. So whether it is zinc, copper, selenium, magnesium, chromium, some solutions may also contain things like iron, molybdenum, iodine, fluoride. It depends upon what the patient requires. Those can be given, and how long the patient is on PN, and whether the patient is on TPN or SPN, that is supplementary parenteral nutrition. So that adjustment will have to be done. Sometimes adjustments also have to be done for electrolytes, and especially neonatal or pediatric formulations, which we will not talk today, but we'll talk on some other day. So in special conditions like burns, we know that there is high skin losses, and these are the patients who need zinc, copper, selenium. Okay, so when we are giving a critically ill patient, we need to understand the condition in which they are admitted. So even if we say trace elements which require bile for excretion, so if it has copper and magnesium, how will you be able to give a solution that has got trace elements? Therefore, we need sometimes to go from a ready bag to a compounded parenteral nutrition. Talking about the electrolyte requirements for adults, it is also based on their individual clinical status, but more or less electrolyte dosage would be sodium, potassium, calcium, magnesium, phosphorus as per the requirements of the daily RDA, and it should be administered through a multi-chambered bag. Also, when PN is individually compounded, okay, not like as a part of the bag, you have to look for sodium chloride, so potassium chloride, calcium chloride, magnesium sulfate. These are used. Uh, Remember that when we are planning for a PN, we have to also consider the water requirement. Okay, how will you calculate? Very simple way of calculating the water requirement, around 30 to 40 ml per day for a normal individual. But if the patient is restricted, say there is renal issue or patient has got extra diarrhea, then the fluid requirement will be based on those other conditions. However, when we are giving, you also have to consider the electrolyte content of any other parenteral nutrition that is going on, like NaCl or saline or ringer lactate, or these things. So the electrolytes here have to be adjusted based on that. So that's how we can adjust the electrolytes. So the year you have to understand that when we talk about parenteral nutrition, we have to talk about a balanced parenteral nutrition in terms of proteins, carbohydrates, lipids, as well as micronutrients. Close monitoring is required and essential. In the other lecture, I'll be talking about different complications, step by step preparations of parenteral nutrition. Do attend the other lectures, which also has in what situations you need a parental nutrition, how can you plan a parental nutrition, what is the calculations for it. All these I will be explaining in my other lectures. So I thank you very much for listening carefully to me. Glad that you're here. If you need more information, my on the screen my mobile number is there. I also thank Academy of Nutritional Sciences for allowing me to give you this talk. If you need to contact the academy number is as well as there. Academy does a number of courses and educational programs, so if you have any interest, you can get in touch. If you require to purchase my books, it's available on Kindle, whether it is on dysphagia, on transplant, or vegan diet. All these are available. And you can also follow Academy of Nutritional Sciences on social media. I'll be there if you need me. Just contact me, and I thank you very much for attending this.